Thank y'all so much for coming today to our learning lunch, and our sponsor today is Moskilla Gaming. So whenever you happen to see them, thank you so much. Tell them thank you for sponsoring our event today. And be sure and go to our website, www.hopechamber.com, for all of our chamber events, and there's where our calendar is, and that way you can always see what's going on here at the chamber, and if there happens to be a change or whatever the case may be. So be sure and check www.hopechamber.com, or also on Facebook. You can also register for our events online through the website. Just a couple of announcements as can't believe we're a month away from Christmas, and the year is almost over for 2021. So a couple of things that we have going on. November the 18th, which is Thursday, we have our purse raffle. Be sure and check your planner, your chamber planner for your number. Also, our new planners for next year, we should have them within the next couple of weeks. They are at print. We're keeping our fingers crossed. So we hope to have those within the next couple of weeks. Yvonne's gonna go get one. Our sample, because they're really, really nice. I really love them this year. I liked last year too, but I really like this year. Because last year was our first year, and we kind of learned a few things from it. So, there's still, again, $40, and that's a chance to win a gift. There'll be 2 gifts still given, monthly, and then quarterly, we'll have 1 gift of $1,000 value. So, this is our planner for this year. And since Kentucky Derby is kind of our theme, as you can see, we have the Kentucky Derby and the roses. And here's the 2022. You have your name, and your number, and then you have the whole year, and then we have the banquet for January. Somewhere in here is the sponsors, because we only have 2 premier sponsors, and it's First National Bank and Lions AC and Hindi. So here is who our $300, our 2 $300 gifts for that month, plus our banquet. You have a monthly, plus everything that's going on at the chamber at the time that our planners were made. Then you have a weekly. Isn't that neat? I think it's so neat. So I'm real proud of it. And then we have a bowling tournament in February, and it just goes on. But be sure and get a planner. Oh, absolutely, absolutely. And this will be cut out. It's not cut out your tabs, the white, because this is just our sample, but that will be cut out. So we're real proud of our planner. Also on Thursday evening, we have our linos. Rachel is going to be doing our Christmas craft, and I can tell you it's gonna be a lot of fun. I've been purchasing everything for it, so it's gonna be a lot of fun. We're making a Christmas tree. What she just said. So be sure, if you have not signed up, we only have a couple of spots left. We have 1 spot left, and that will be at 5:30. November the 19th, we have a ribbon cutting for Texas Gifts and More at 9:30. That is on Highway 190 West, and it's close by Pine Forest, First Baptist Church, or Pine Forest Baptist Church. It's close to it, so whenever you see the church on the left, you better slow down, because it's just a little bitty, small building. So that will be at 9:30 on Friday night. December the 14th is our quarterly membership luncheon. The city of Goodrich will be giving us a state of the address, plus we will also be recognizing 2 community service awards. And that will be over at Long Branch Steakhouse at 12 noon. December the 16th will be our purse raffle. That will be the end of the quarter as well as our monthly. And then of course course, remember, January the 27th is our 86th annual awards banquet at 5:30. So everyone wants to be sure and attend that. It's gonna be a lot of fun. Today, we're very, very happy to have Tina with CHI, and I'm gonna let her introduce Jock. I just said his name, but anyway, we're gonna let her introduce Jock as well. So thank you so very much for both of you taking your time out of your busy schedule to come and present our learning lunch. So Tina and Jock, it's all yours.
All right, thank you. Piggyback off of what Janet said, thank you guys for taking time out of your busy day to come by and hear what we have to say. As protocol with our hospital, we do a reflection before each meeting. And so I was going through trying to figure out what could I do for this group, and came across this one, and it says, if your body's not right, the rest of your day will go all wrong. Take care of yourself. So my name is Tina. I'm I'm with St. Luke's Health Memorial, but I'm also on your local board of directors for the Chamber of Commerce, which has been, this is my first year, and it's been very interesting. Jacques is going to take it away and give you his name and some background, and I hope you enjoy our presentation.
Thank y'all for the invitation.
Some pictures.
We'll do a test on how to spell my last name out. No, my name is Jacques Delahoussi. I'm a radiology PAI with Baylor College of Medicine, but I'm here locally at CHI St. Luke's, contracted at CHI St. Luke's. I've been at the medical center, Methodist, before I went to Lufkin. I was in Lufkin at Lufkin Memorial for 12 years before I was lucky enough to come back home. I say home now, at Livingston. So interventional radiology, I'm the one that actually sticks needles in people. I do the biopsy. So that's what my read x-rays and do interventional work. So that's a little bit about me. I don't bore you all about that stuff. Also co-owner of Legacy Fitness Center here in Texas. So yeah. So what I'm going to go over is quite a bit of stuff, so I'm trying not to bore you with little things. Tina put a package together in this pouch, the bag. First of all, the ticket to the front is for the door prize. I believe, Tina, the door prize.
We're going to do a couple.
Okay. So there's going to be a door prize. Also, in the package, it has some stuff that we'll go over in a little bit. I'm going to kind of briefly touch on women's health. A little bit of PMs type stuff for women's health. PM is preventative maintenance, kind of like your car preventative maintenance. For women's health preventative maintenance, we'll go into the regular health that Tina brought in the package. Want to go over a little bit of, everybody knows about breast cancer and breast awareness, but I want to kind of dive into just a little bit deeper into what we have here to offer with CHI, whether in Livingston or in Lufkin. Most of this stuff is going to be mirrored both places, but there's going to be a couple things that'll just be either in one facility, and I'll kind of explain that. So breast cancer, everybody understand breast cancer a little bit. Basically, it's cancer cells that don't act like other cancer cells. They actually kind of have their own, they beat to their own drum, so they don't die off like a regular cell. They actually kind of regenerate a little bit faster. So those things are what we're trying to pick up as early as we can, whether it's in the breast or somewhere else. But we'll kind of focus in a little bit on the breast about that. There's many types of cancers that are in the breast, but the cancers that we try to find is early on cancers. Whatever we can do, the earlier that we can find, the better treatment that we have. The awesome thing that we have, I'm trying to see how many years ago, it's been probably 4 or 5 years ago, we have a tomographic mammo machine, and it's a 3D machine. It's the best that they have in the market. We have it here in Livingston and also in Lufkin. Understand that whenever we do a mammo, that radiologists read these mammos. We have two gentlemen here, myself and another Dr. Richard Purchase comes in from the Woodlands. He's mammographically trained also. So he's trained to read these things. So everybody wonders, well, I need to go to Houston to get my mammo because they do and they see it. And I understand that, especially if that's where you're comfortable going. But understand your OB-GYN, they don't know what to look at. They'll look at a mammo, they don't even know how to hold it upright. So it doesn't matter where you have your yearly. But the whole thing is getting your mammogram. And we like to have consistency. So what it means is if you're going to Houston and have your mammogram, and the following year you have your mammogram, it's best to have it, or at least have the images from the same place. Why does that make a difference? Because we always look at the previous to see if any changes. And we usually do 2 years. So we usually skip a year and then we do the 2 years following because it gives us a drastic change, a better change. So in that, what I'm saying is, even if you go have it done in Houston and you want to continue down there, it's great because they'll have your mammograms. But if you're going to move to another one, at least bring the disc with you and bring those images, and so they can download it, put it on a system we call PACS, and it can be archived in that system. So I always tell the ladies, especially the ladies that travel, because we see a lot of escapees, go ahead and ask them for a disc, and just go ahead and keep it on file for them, and just take it with you and continue with it. So how often should we get a mammogram? I said, should we? Because I've had a mammogram too, because I wanted to see what it felt like. So it's not just women. Guys have mammograms too, yes. And I diagnosed a male breast cancer last year, so it happens. How old? We unfortunately I did one a year and a half ago. About a year and a half ago, a pregnant lady, breast cancer. The outcome was good, but it was pretty severe during that time. So it doesn't matter. 20 years old, we see them now. So the whole thing is, in that age group, up to we say 40, is breast self-exam. Examination is very important. If you don't know how to do that, you can go. There's online stuff to teach you how to do breast self-examination. The American Cancer Society recommends at 40 to get yearlies. So at 40 years old, you start your yearlies. Now they're recommending it, but at 45 is when you truly should start getting your yearlies. So between 40 and 45, they said they kind of gives up to the patient, but I would say 40 and do your yearlies. And then they say after 55, you're supposed to go. You can go to every 2 years. I say continue. They pay for it. Go ahead and continue the yearlies after that. So continue. The back to the original thing that I was kind of going down. The machine that we have, the 3D tomography machine, they don't even have this in Beaumont, this particular machine. Well, they didn't. They probably do now. Because it's called C-View, big names and everything else. Basically, it combines the conventional mammography with the 3D, and it kind of marries them together, so it's low dosage. So you only have to do one. We do 2 images, but there's only one set of images that we do, so we don't have to do multiple. So for the patient, you have less radiation dose. So it's definitely a benefit. So that helps the patient care, and it helps us too. And 3D tomography, what does it do? It decreases the rate that we have to bring patients back for additional views. So let's say we do a mammo, and there's something that's questionable. Well, we bring the patient back. Usually they'll do a callback, we call it, and then they'll kind of interrogate that area a little bit further. But with the new 3D tomography machine, there's a 41% decrease in that callback rate because we're able to interrogate that a lot better. So I can put it like a regular picture. If you're looking at a picture, you see that a single image, that's the way the old image was. You can look at the breast and everything. The new 3D, so if you have one of those flip books that you know how you can flip and you can see it, our cartoon books, and it's moving, it's kind of like that. We can actually, it scrolls through the whole breast. So it's like opening up a whole new world. So we can actually go through that area and scan through it. So that's where the 3D comes to play. Not only does it decrease the callback rate, but it actually, we can find cancers about 15 months sooner with this machine. So that's pretty impressive. Because the whole thing is, the sooner you can see it, the sooner you can treat it, the better the outcome. So if you can get a cancer before it's invasive that it goes into the outside cells. If we can get it and capture it before then, and either take it out or treat it, there's a 100% chance of survival rate for 5 years. So, I mean, it's huge, you know, so the sooner that we can get it, the sooner, so if you're at home and you're washing up or whatever and you feel something, stop, okay? Go to your doctor, say, I feel something. Don't, oh, well, let me see if it's gonna go away and kind of put it off. You know, we all do that, but we see it. I saw it last week. A lady kept on putting it off for 2 months. And it grew and it grew and it grew, and it's invasive. So the sooner we can get it, the sooner we can treat it, the sooner we can take care of it. So what's the treatment? Depending on what it is, but they all come see me. Usually if we have a suspicious area, they come back and see me. I do all the breast biopsies here at Livingston. I used to do them in Lufkin. I was traveling back and forth. Now I'm lucky enough not to have to travel. So I do all the breast biopsies. Whether that's in stereotactic or mammography, we do it under compression, or if it's ultrasound guidance. And we do it with a needle. The old way of doing it, the patient would come in, we find the area, we put a special little wire there, and they'd have to go to surgery and take it. That's the old way. About 15 years ago, we actually they came up with a device. It's a vacuum-assisted device. We actually put a needle down there and suck out the tissue, and that's what we send over. So it's done through a little skin incision, no stitches, nothing. Done the same day, and they go home the same day. It's the least invasive, the best outcome. Did one of our employees yesterday. I went and checked on her today. She didn't even know she had it done. I mean, it was great, and that's the way it should go. Is it painless? It's virtually painless. So anyway, so don't be scared of the biopsy portion of it. It's fairly simple. It's pretty dramatic for the patient. You know, everybody thinks it, but it's a pretty quick procedure. So I'll probably jump around a little bit. Y'all can stop me if you have any questions, please.
So what age do you quit getting mammograms?
You know, that's it's depending on what it is. Now, I will tell you this. I will stop having my prostate checked at 80 years old. I'm not gonna have that. So, you know, if at 80 years old and you don't think that you have any kind of issues, don't get a mammogram. You know, if you're not gonna do any treatment, I always tell patients, if you're not gonna fix it, don't look for it. If you're at 80 years old and you're gonna, well, I'm not gonna get them to do any radiation or chemo and everything, don't look, okay? Because you will find something. If you may, I mean, I don't say you will find, but there's a chance. So you gotta be willing. I mean, I have that all the time. I have patients that come over here, hey, I'm gonna do a lung biopsy. Lung biopsy is a little bit different because it's a lot more invasive than a breast biopsy because there's a lot more risk. Okay, are you gonna do anything if I find out what it is? No, I don't want to. Okay, do you really want to know? There's a chance that you could die from the procedure, you know, just so the risk versus benefit, that's a whole nother deal, you know, at 80, 85, depending. I mean, there's some 80-year-olds that look great and that's going to live another, you know, 10, 15 years. So American Cancer Society does not put a number on that because that's the variable. So you have to kind of take it, if the patient wants treatment or is encouraged over there, and I don't push them for treatment. I explain the treatment and give them the options. I always do that for my patients. The option is doing nothing. That is one of the options. So I give them that option too. So I just try to be as honest as I can. You know, I can't put it whether you're my mom or something like that. I just have to give them that information. Everybody always says, well, I do this for my mom. I'm going to take care of the patient no matter if it's my mom or my dad. So that's me. Breast cancer, we have some numbers, and I kind of throw out some numbers because they're kind of scary. 1 in 8 women will be diagnosed with breast cancer in a lifetime. Okay. So everybody always says, well, risk factors. Well, I don't have anybody in my family that had breast cancer. This lung can't be cancer. You know, that's about over 75% of breast cancers do not have any predispositions, no family with it. So just because I hear that quite often, don't take that. It doesn't matter. It doesn't matter. So that's one of the deal. Let's see, 3 out of 4 diagnosed with breast cancer have no known previous risk factors. 25% of women who die from breast cancer are in their 40s. That's kind of scary. But 100%, nearly, not 100, nearly 100% of cancer is detected before it's spread. Got a 5-year survival rate. So that's kind of back to that. So if you can get it early, you know, that's the best thing. We have awesome machines. We have awesome, the ACR, it's our accreditation body, they actually look at everything. We have, every day they come in, our monitors, we read on monitors, computer monitors, but these are fancy big computer monitors. They have to be so many pixels, it has to be so right. They come in every day and they have to check these monitors. So you can't have a speck of anything on these things. It is very, very calibrated. Everything is pretty systematic. Treatment is, for breast cancer, it's almost like a chart. You go down a flow chart and you come down, you have breast cancer, you have DCIS, ductal carcinoma in situ, well, you do this. And so whether you go to MD Anderson or you go to Lufkin Memorial with CHI, you would be this treatment. So the treatment for breast cancer is pretty much, it's standardized. There's not a guessing game on this stuff. They, have it set up pretty much. Now, different cancers are a little bit different, but breast cancer is pretty straightforward when it comes to that. They have some guidelines that you go by on what you do, depending on it. Because it's all, there's a whole bunch of numbers that go with it. Just because you get a sample and it tells you what it is, what type of cancer. We look at lymph nodes, we look at other stuff, the margins, all big words over there, to see what category that it goes in and to see how it's treated. And once they figure that out, then they know the treatment that they can go to. So everybody says, well, I have breast cancer. That's a wide margin. DCIS it's one type of, we call it breast cancer, but it's ductal carcinoma in situ. It's really a transitional. So if we can get it early on, that's actually truly not a cancer, because it's actually an early type, but it can change into a cancer. So that kind of stuff. So the confusion is when somebody says breast cancer, don't take a deep breath, find out what it is, talk to an oncologist, and they can guide you down the path that needs to. But early detection, that's the main thing. Everybody always says that, and I'm a firm believer. If you feel something, it doesn't matter if you think it's a cyst or you think it's just, get something done by it. At least talk to your doctor and get it, keep your mammos, keep them, up to date. Don't skip, get it done. So that's my little harping on that stuff. So that's about the mammo portion. Any question about that?
You mentioned different types,
Mhm.
and so, as far as someone having is that typically you monitor that, or is that just straight into a biopsy versus something type of mass that's in there?
Great question.
Is that making sense?
Yo, you
Someone
no,
has
tell
that
me.
mass in there, and you're like, well, no, we're not even doing a biopsy because it's processed. Will that mass, or maybe, is that likely to turn into cancer, or?
Great question. Her question is, do we just sit there and watch anything just to say we know it is, this is a transitional step? First of all, no, because we never are comfortable enough to say watch anything. The biopsy's too easy. We don't know what it is, first of all. It looks like this, it smells like this, but it ain't tasting like, because we don't know. Truth of the matter is, the only way of knowing is taking a sample. Now back to DCIS. So we probably, if we called it DCIS, and there are calcifications. I mean, I can tell you this is the weird thing. Calcifications anywhere else in your body, we don't worry about. If you have calcifications, it builds up everywhere. Calcification in your breast looks certain ways. It has a certain look, a certain alignment. I could hold up 20 of them and you'd be just flabbergasted the difference between them. But these calcifications is what we call the precursor for DCIS, the ductal carcinoma in situ. And by looking at that dust, what it looks like, a little piece of speck of dust on there, we have to take a sample of it. So I'd stick a needle down there, take out one of them, take out a whole bunch of them, whatever, it doesn't matter. So we send it to the pathologist, usually takes a few days, get the results back. After we get it diagnosed with DCIS, depending on where the patient is, what the stage is, if it's an 85-year-old patient, we might not do anything to it. If it's a 55-year-old patient, we'd probably go ahead and they'd probably go to surgery and excise that area. And that might be their only treatment. So depending on what it is, but the only way, true way, back to your question is, if it's a mass that's in your breast, not unless it's a cyst. Now sometimes we'll just draw out the fluid and cyst and be done, but a true mass, we usually take take a sample of it and find out what it is. And then we'll make an educated decision on what to do next. But that's the only way of knowing. We don't know. You can say it looks like something. Believe me, I don't know how many things have looked like one thing and came back something totally different. Now there's some stuff, usually if it looks like cancer, but if a patient asks me, what do you think? I think it's suspicious enough for me to do a biopsy. So that our recommendation is to get the sample. Let's figure out that. Does that kind of answer your question a little bit? Yeah. So, the other stuff that what we do in X-ray or in radiology, our portion of DXA scan, bone density scan. That's something that's kind of like the silent disease. They call it because you never know until you break something, break a hip, and female, you have higher susceptible to have osteoporosis. So let's say, what's osteoporosis? Basically, it's bone density. It's kind of like a sponge. The sponge actually starts getting bigger pores in it. It gets a little bit more brittle. So you get a brittle area. And so that's osteoporosis. So there is osteopenia, which is in the middle, and osteoporosis. Why is it important to find out? Because you can't just turn a switch and one day that you're normal and the next day you have osteoporosis or go back. Now, there is a treatment for it if you ever get osteoporosis. So why would somebody have osteoporosis? Well, there's some risk factors. Gender, female, sorry guys, breast cancer and osteoporosis, but guys get osteoporosis too. Hormone supplements, if we are on steroids or something like that, or females are on steroids, that actually decreases your bone density. Age is a factor, race is a factor, and body size is a factor. So all this is a factor on osteoporosis. So we do a procedure, it's very simple. You lay on a table, it's no radiation or anything like that, a few minutes over there, and they send the images and the information to me. It has these fancy numbers over there. We use these factors and we can tell somebody if they're osteopenia, normal bone density, osteopenia or osteoporosis. What does that make a difference is because if you're osteoporosis, you have a higher risk of falling into some major kind of fracture, break a hip, break something. Being young, you don't have to usually have to worry about that, but it's a good time to get a baseline. And they usually suggest baselines at 40 years old for the bone density. What can you do to treatment over there? The best thing you can do is work out. Come to Living Statistics. No. Workout is the best treatment. By all means, we can see that change almost immediately after they start working out. Getting the bone growth by the impact over there, it doesn't have to be heavy workout. Walking, that kind of workout, that's the best way to get that down. So, but working out is good. Vitamin D is a great thing. So there are other vitamins is a really big thing to help out. There are also other medication that you can take that help encourage bone growth. But if you get too far over there, it's like trying to climb that ladder. So to try to stay ahead of it, it's a big thing. So anyway, that's what happens. They get them done every year. Usually they have them done with their mammo after a certain age. They'll get their bone density scan. Like I said, it's simple. You just lay over there, lay on the table over there. I've had it done. And we evaluate your spine and a hip. And if you had a fracture on the hip, we'll do a wrist. And we take this measurement and it goes into calculation, and then it actually goes to, I don't know where all these calculations come from, but they put it all in a compile, the calculations, and we dictate out for your physician. And understand that some people get a little confused on this is a mammo and the bone density stuff, the report goes to your physician. So you can be in Houston, have your even MRI or CT, because truthfully, your orthopod, or your regular general physician, they wouldn't have a clue how to look at an X-ray. And that's the truth, because that's what, it's different, or a CT scan or MRI. Now, some of them like to do a chest X-ray, but that's why the radiologists get the report. So we give them a report, so that report goes. So you can actually have something down in Houston or have a physician somewhere else, and you get an MRI report. There's no reason to go to Houston to get your MRI. We have an awesome MRI scanner and a great CT scanner here. And I'm not just saying that, I'm the truth, because I've worked at the medical center, I worked in Houston, we have awesome equipment. and get it done here, and they get the report. I mean, it's electronically sent to them, so they get the report. So you can have it done anywhere. Any of these studies you can have done, even your labs and stuff. It just drives me crazy when these doctors send a patient somewhere outside to get somewhere, and it's just so inconvenient. I mean, I see a 75-year-old lady, you know, driving to Houston, trying to get her study over there when she can have it done here, and they can just have the report there. I mean, it's a disservice for the patient, so that just bothers the heck out of me. So we have awesome equipment, we have great techs, I really do say that. I mean, my partner here comes from Houston, the Woodlands, and comes up here and reads, so it doesn't, I mean, I'm gonna get better reports over there, you know, maybe if I'm reading, but you know, but the truth of the matter is, I mean, he comes in, he's trained, he's highly trained, he's a little older than me. I'm not going to go how old, but yeah, a little older than me, and he's been doing it for years too. So I mean, you're getting excellent reports wherever you're going. I promise you that. And actually, the benefit that you have with us, I work for Baylor College of Medicine. I do not work for the hospital. They're not paying me. So I'm at Baylor College of Medicine, but I'm contracted here at this hospital. Both of us are doing that. Our staff at Baylor College of Medicine in Houston, we have a specialist, well, we have many specialists. We have a body specialist, we have a neuro specialist. So unlike you go to a smaller facility that might read everything, we actually call our guys over there. So we have a questionable thing, this mass is unique, we don't have these guys over there in Houston, they're always with us because they can read, they read on our system also, so they can look at it. So we have the top notch, just like you were going to the medical center. We read, I've been at the medical center, that's us. We're at Texas Children's, we read Texas Children. So all of that stuff is still part of our group. So just because you're having an exam done here, you're not getting a lower level of anything. You're getting quality equipment, quality care, and the quality report. And if you have a question about that, you're always welcome to give us a holler. I mean, that's the good thing, there's not a number. You know, yes, I would go to MD Anderson for certain cancers, there's no doubt about it, you know. But before you get there, there's no reason to go to MD Anderson to get your biopsy, because you're just gonna be a number, you're gonna do a breast biopsy by something else, and it's gonna be waiting in line to be able to, I'm not just saying that. I mean, some people just say, you have every option. I'm just saying, you'll be able to get it done a lot quicker, a lot more convenient, have your friends and family, and probably somebody that you know that's close to you here. That's the benefit.
If you see someone who needs a biopsy, you're saying that's scheduled through you to come back and do that biopsy?
Yes.
It's not going to the doctor, having the doctor look and read your report that you're able to read to the patient, so it's all done through you?
If you're a local, here, now whenever I was at different facility, our system, the way we work it, you come in, whether it's a diagnostic mammo or a screening mammo. A diagnostic mammo means I feel something and we have to do a certain study. Screening mammo, you come in just your yearly. We find this area, we find a mass. We send you, usually, right, you're there, we'll do an ultrasound. So ultrasound is another modality that we use to help interrogate that, whatever it is. So we'll do it and we say, okay, this is a suspicious area. So what do we do next? Well, I'll go in there and talk to the patient. Every patient that has a biopsy, I talk to every one of them, unless I'm out of town. But I talk to all the patients and discuss the options. And then before they leave out of there, they're gonna be scheduled for a biopsy. And then I'll call their physician and tell them what our plans are. Once they come over there for the mammogram, they're my responsibility, okay? The physicians can direct it. The physicians are more like an aircraft controller. They're going to kind of direct whatever. They're coming to us once they're in my care that we take care of that stuff. Now, I do the biopsy, but the physician will give the results to them because they have that kind of rapport with them. So once I'm finished my stuff over there, I do the biopsy. Usually it takes about 3 or 4 days later to get that sample back from the pathologist. I'll make sure that I talk to the physician, make sure that they have the results, and then we can work it. We do about 3 to 4,000 mammos here a year. About 60 to 70 biopsies, breast biopsies. I do tons of other kinds. We do livers, lungs, all that stuff, but breast biopsies, about 60 to 70 a year. So we do quite a few. And 99% chance of whenever I go to do a biopsy, I'm gonna know what it is, whether it's benign or whether it's positive. Now there's still a 1% chance over there. I mean, it's very remote, but you know, get a false sample or something like that. But it's 99%. Once we go in there, we see it, we biopsy, we sample it, we're comfortable, we're done. We know what it is. So it's pretty good. We have pretty good results. I'm really pleased with our system that we have here. We're pretty blessed. We have some good techs. So,
Jock, I have a question.
yes, ma'am.
Back on the osteoporosis and the breast cancer, actually, as far as hormone related issues,
Good question.
what are your thoughts on that?
Well, first of all, osteoporosis, we asked a couple things, premenopausal, postmenopausal. Postmenopausal, the risk goes up. The hormone supplement, that's what she's going. So postmenopausal, usually that they start their hormone supplement, estrogen type of hormone, because that is the number one reason, not besides making the hot flashes and emotional stuff like that, it'll actually cause an issue with their bone density too. So that's another thing that uses that, so hormone supplement is a big deal on that for osteoporosis. So it's staying on some type of hormone. And there's another stuff that we use to build up both bone growth also, along with the hormone supplement. But that's a big thing, premenopausal for postmenopausal. But yeah, great question over there. So yeah, it's important to take your hormones. Besides emotionally and keeping a good well-being, it actually helps keep your bone growth not too crazy. Yeah. Thanks. We're going to kind of go over a little bit of what CHI I was at. Now, this I'm going. Tina handed me the packet a little bit to kind of go over what we have in your packet, as far as what other kind of things that we have to offer. Do y'all know the Ores? Rachel and Dan, Dr. Ore? Does anybody? They're the new OB-GYNs here in town. I know them because they bought my old house, but also they're great. We're blessed to have them. Dan and Rachel Ore, they've been here 3 years now, maybe 3 years, something like that. Really great OB-GYNs, really good people. We're blessed to have them here. So that's two that it's nice to have them. That was on the sheet. That's if you need to see the picture of them. They're right there. This is the 3D mammography. We know about that. I went over that 3D mammography. Oh, also in the Mammo machine. I've had it done because I told them I would not talk about it. I would not promote it unless I had it done. I had it done. It's uncomfortable. Yeah, I'm not gonna lie. They use a pad. We used to call it Mammo pad. They call it something else. I should ask one of the girls. But they put it on the machine. It's a very, very thin pad. It makes it a little bit more comfortable, and a little bit more comfortable. I'm sure somebody's had it done here, over there, and they squish your breast down over there. I know some of the younger ones probably don't understand it, but they'll squish your breast down. Then we do two views. We do a view that's from the top, then we do a view from the side, and we do that on each breast. But with this pad, it actually helps out. The new machine actually has the paddle, we call it. It's kind of scary, but the paddle that actually compresses, it actually has rounded margins on it. So it actually helps out, because where the patients complain the most of, because it pulls the skin towards from the chest wall itself, and they have to really get in to get it, because if not, we have to make them go back. You want them to get it, so we have a lot of things. And I went and talked to the mammographers. What makes them different? They actually go and talk to the patient ahead of time and tell them what to expect, especially the ones that never had a mammo done. So they kind of explain, you're in control. They actually have a meter on there on compression, on not only thickness, but how many pounds of pressure that they actually have to compress. So they take that number in consideration, and we can look at that number whenever we're looking at it. So they actually let the patient, if it's too uncomfortable for the patient or for y'all, let them know. And it's ease up, it's killing me. Then they can actually maybe do a little bit different to help out a little bit. So here, I can just tell you from experience here, we have really good equipment. We have the pads that help out, and we have some great mammographers. We have two mammographers. Mandy and Amanda are really awesome, and they are certified. Everybody, there's just not somebody off the street that we stick over there to start compressing your breast. They go through much schooling that really, it's really awesome. And these ladies, have been doing quite a few years. So if you ever get it done and you're uncomfortable, let them know. That can actually alter it just a little bit. But the machine that we have is, I would say it's as best as it's going to get, you know, for stuff. That's a big deal. We have something on strokes, the fast thing on there, whole thing about strokes. That's for everybody. That's real important because we're a stroke center. Is time is the essence. If you ever hear anybody that says anything that you see a facial drooping, they think they might have had a stroke, or don't even hesitate. Just go to the emergency room. Because why is that we have medicine that we use over there in the emergency room that actually can reverse it. And if we don't get that 2-hour window, then we can't use it. So it's all about time on stroke. Very, very important about the stroke. Now about the Heart Center, Tina probably gonna have to, I've been out of Lufkin for 7 years now. I know we're the Heart Center and I know we're accredited and all the stuff on there, but I can't give you all the thrills about it. Sorry. ENT service that we have 2 guys that are coming down from Lufkin, Dr. Baylor, Dr. Bam, excuse me. I haven't met Dr. Bam yet, but they're coming down a couple days a week for ENT to this facility here. They're starting to do more and more stuff remotely. That coming down, the guys are starting to come down, which is, you don't see that as much anymore because people are they don't want to travel as much, but we're getting more people. Like we have the surgeons coming down from Lufkin. They come down and do our rotations during the weekends and take up some other stuff. So it's pretty cool. And then we have robotics. So the robotics that in Lufkin is pretty awesome. Now that's the new innovation type stuff. It's the downtime, everything is done by robotics. And the last thing I see is the low dose lung cancer screening. There's a full questionnaire stuff over there, but you can get it's kind of like a CT, what is a CT scan? It's called low dose, so they can do a screening of your lungs to try to detect early. But like I said, we have some awesome equipment, awesome people here at the Livingston facility and Lufkin facility. I mean, I was at Lufkin for 12 years before I came to Livingston. State of the art stuff. There is some things definitely I would not have done in Livingston. We don't have the backup. There's things. I mean, we know that. You might have to go to Houston and stuff. And that's totally understandable. I'm not saying come use this for everything or CHI, there things, but anyway. Thank y'all so much for putting up with me.
Thank you.
Anybody have any questions?
I do have a question.
Yes.
I'm a youngster. What can I do to prevent cancers in my young years as we get older? I know that some things can't be
Don't smoke, got lung cancer, we can do that, heart disease, and so, but, you know, healthy living, you know, that's the main thing with anything, it's healthy living. You can do whatever you want, and you might not, you can't deter breast cancer.
Right.
You know, the whole thing is be adamant about it. Know your body, know your breast. I know that sounds weird or whatever, but know it. You know, figure out how to do it. Figure out things. Younger women, we have fibrocystic breasts, and they're hard, they're lumpy. You know, that's a problem, and that's a whole nother deal. I can go into a whole diatribe about that, but the whole thing is know your body, know it is. If there's anything over there, if you have any nipple discharge, I mean any. Okay, I have a yellow nipple discharge. Probably not gonna be a problem. If you have any bloody discharge, it doesn't matter with age, tell your doctor. We do another thing because that's papillary carcinoma. That's another type of stuff over there. So know your body, just be aware of it. That's the whole thing for breast cancer. The rest of the stuff like osteoporosis, perfect example. One of the risk factors, increase the risk is what you're eating, drinking, you're smoking, that decreases your bone density. If you drink a lot or if you smoke, that's a thing over there. Lung cancer, we all know that. I do lung biopsies all the time, and patient says, you know, well, I know somebody that's never smoked in their life that had lung cancer. They always use that, but that, you know, the lung cancers that are smokers versus, I mean, I've done both, but there's probably, I count on one hand of the non-smokers versus the smokers, you know, so. that kind of stuff. So healthy living, I mean, we all enjoy drink and do this stuff out there, you do stuff, but know your body. You know, be aware of it, let your doctor know, get something done, don't put it off. I mean, I see it so many times, just these little young ladies that just, I felt this, I think it's gonna go away. It might be a cyst, but we don't know. We'll ultrasound it, find out what it is. It's too easy, get it done. Money or no money. There's places where we have a program called BCCP program, awesome program for women's health. They actually pay for everything.
Okay.
Yeah, it's a BCC program. They start in Lufkin. They come down here. I don't know all the specifics about it. I'm sorry. You can call the Mammo department. They probably can help you. But they actually used to come down here and do pap smears and everything. But it's called BCCP. If you know anybody that needs it and they're wanting something like that, encourage them to reach out. There's stuff there. I mean, there is stuff there. Don't let money hold you from finding out what that is. That's the most important thing. It's
I
not
have
worth it.
another question.
Yes, ma'am.
If you have the gene or the trait for breast cancer, like if your family has it, how do you find out about it?
You got to do the genome testing. You know, they come in there and they do your blood and they send it off and get that stuff. That's what you're gonna have to do. And you'll have to get the testing from them also. If they have the cancer, you know, it's basically genetics testing. Because if you know somebody, if your mom had, there's a chance that you could have it too. And they might go ahead and have patients that actually had a mastectomy because they had such a high genotype. Great questions. Thanks again for letting me
Thank you for coming.
bore y'all to death. I appreciate it.
I spoke to someone yesterday in one of the stores, and she was saying on back it didn't hurt because she didn't have insurance. I was gonna talk to some of my marketing friends. Where is somewhere that she could go?
Well-
Because she said it's just really bad.
That's a good question. Now, I don't know as far as the physician, because there are different physicians that are, you know, self-pay and do that kind of stuff. The hospital has a program, Tina, do you remember the name of it? With that, it's a cash pay type deal. It used to be something, what is it? MD Save, we still, are the MD Save? Okay, it's called MD Save, and basically it's pretty cool. I mean, you can, even if you have insurance, you can actually pay it out of pocket. I mean, let's say, I'm gonna use this number, but it's pretty realistic, a $3,000 MRI. The MD Save, and it's our fee along with the other one is included, might be $300 pay cash. And it's that much of a difference. It's like, why? Well, it's a contracted rate that they go with. And you have to follow on your insurance. If you pay for it, you have to follow on your insurance yourself to get the reimbursement stuff, you know, but it's a pretty good thing. We don't advertise it enough. But there's certain exams that they have that. So let's say a lumbar MRI for something, they could actually get that MD Save program, pay cash out of it, have the report, but they still have to have a physician that orders it, back to the original thing. But the MD Save thing, and you can go in online, I think if it's still around, you can look at it, so, pretty neat program. Do we need to pull these? Everybody wants to read these.
For coming and y'all for presenting such a wonderful program and some really neat information. Great information. And I want to thank Noskillo Gaming for our sponsor today and y'all have a wonderful afternoon.
Have a good Thanksgiving.